Great. Hi, everyone. Thank you so much for being here tonight. My name is Miranda Harris Martinez. I'm a fourth-year medical student at the University of Minnesota, and I have the massive privilege of being a health justice fellow with the Social Mission Alliance, which is why I'm here tonight facilitating this webinar titled The Harms of Corporate Capture in Healthcare: How Patients, Clinicians, and Learners Can Resist. This is a part of the Social Mission Alliance's Learner Engagement webinar series. These webinars used to be titled the Student Assembly, but the Student Assembly has now been transitioned into our learner engagement initiatives. This is a forum for health professional trainees and lifelong learners at all stages to engage in dialogue on issues impacting health professional education and the ability of our workforce to advance health equity in this country. We hope to continue using this forum to allow for greater inclusion of perspectives from the community, patients, educators, organizational leaders, and learners in realizing the change that unites the Social Mission Alliance. So for tonight's webinar, our goal is to reflect on how the healthcare system increasingly privileges corporate profit over human life, to the point that patients are denied care, clinicians are burned out, and health professional students are trained inside systems that contradict their values. But we're also going to examine how people are resisting in response to this, whether it be community members, learners, or healthcare professionals. Just so everyone knows, tonight's setup will be a panel followed by an open Q&A, and then there will be an optional 30-minute unstructured discussion at the very end, and this webinar is being recorded. So now I have the massive honor of introducing tonight's panelists. We have Dr. Devesh Vashishta, Executive Director Jamila Headley, and medical student Rauf Ifiktar. I'll invite all of you now to introduce yourselves, your work, and your organization you might be representing tonight, and maybe a fun fact that you can share with the group. Jamila, why don't we start with you?
Hey, everybody. It's really, really great to be with you all tonight. I'm Jamila Headley. I'm the executive director. I've been the executive director of Be a Hero, which is now transforming into building the Patients Union and building a fight force for patients across the country. I am based in Durham, North Carolina, and for about 20 years now, I've been working on healthcare justice. I consider myself, for me, my starting place in this work is myself a patient who is regularly using the healthcare system, someone living with transverse myelitis, neurological condition, and who has, like, for numerous reasons over the course of my life, found myself like constantly interacting with the healthcare system that, like, even someone like me who spends my time figuring out and navigate it and understanding healthcare in this country finds it impossible to navigate. Fun fact about me, I have a 2-year-old who I just put to bed. And this is really a fun fact about him, but it's very cute, which is that he's been singing himself to sleep. We all live in a yellow submarine. So I was serenaded by that before joining this call.
Thanks for sharing, Jamila, and thanks so much for being here. Rauf, why don't you go next?
Thanks, Miranda. Hi, I'm Rauf. I'm a first-year medical student at the University of Minnesota. But I'm technically here representing Students for a National Health Plan at the university. And that's a chapter of the larger national organization, Physicians for a National Health Plan. So single-payer advocacy. And I see Sanjeev is here. He's one of my other SNAP members. Caden couldn't make it, I think. But yeah, that's the work we do, is mostly advocating for healthcare reform. And then a fun fact about me is I graduated undergrad in 2023. And between that and starting med school this past fall, I lived in Boston and was working in software.
I didn't know that. Awesome. And Devesh, I see that you joined the call. Why don't you introduce yourself, your work, and a fun fact?
Yeah, well, it's so nice to see all of you. I apologize for running late. I was just finishing up in clinic here. So my name is Devesh Vashishta. I'm a family medicine physician, and I practice at an FQHC, also known as a community health center, here in San Marcos, which is a city just north of San Diego. And yeah, I have a sort of history of activism trying to organize physicians and APPs in the FQHC setting, and really believe that, we need to speak out for our rights because it allows us to care for our patients and community more effectively that way. So looking forward to meeting you all tonight.
We are so honored to have all of you here. So let's get started with the panel questions. The first question I had for you all is I was hoping if you could share a story or experience where you've witnessed the effects of profit-driven decision-making shaping healthcare, whether that be in patient care, in clinical practice, or in medical training. So Jamila, why don't we start with you and your story?
Yeah, gosh, it's so hard to choose just one story because actually this is around us and like just every day, all day. But I actually wanted to share two really quickly if I can. The first is I shared a little bit that I live with transverse myelitis and I was diagnosed 19 years ago, a couple weeks ago, so a long time ago now. I was really suddenly paralyzed from the waist down. I had just graduated college a semester early. I was 21. I was like, not a care in the world, definitely not thinking about health, about my health. Um, and found myself uninsured and incredibly ill and in need of care. And it's a longer story that, like lots of people in my life, I was already engaged to some degree in healthcare justice work. And lots of people in my life advocated for me to get the care I needed. But one of the memories that stick out really like in my mind and sort of haunts me still is I spent 6 months in hospital between hospital, inpatient rehab. And I had someone who I shared a room with at one point. Her name was Nadine. She was a kid. We were both pretty young. She was a little younger than me. And and she had insurance. I didn't. I spent like most of my days completely racked with worry about what my healthcare bills were going to be and like watching as like the bills came in, like as my mom was getting the bills from the hospital as I was there and just like feeling really terrified about what it would do to my future, to my family who really couldn't afford any of this. Um, but Nadine had insurance and she should have been okay. Um, but instead, she got discharged. She was just now beginning to get some mobility back and she was just now beginning to see some improvement. And I remember like hearing her parents on the phone, like arguing with the insurance company because they were trying to kick her out of rehab before her doctors were saying that she needed to be finished with rehab. And she ended up leaving and I ended up getting to stay. And I was just like, why do I get the care that I needed? In part because like I didn't have insurance and sort of like at some stage like people had advocated with the hospital CEO on my behalf and I ended up getting charity care that covered what I needed and I got the care I needed and I'm walking. And I actually don't know. I'm not in touch with Nadine anymore. I don't know what happened to her and what her journey was like, but it haunts me because in our for-profit system, this family that should have been better off than I was, right? Like because they were in the system of the logic of profit and a profiteer that gets to decide over and above her doctors what she needed, she didn't get the care she needed in that moment. That memory is like seared in my brain and so much animates part of what I do. So that's one story. And the other one is sort of before that for me, I grew up in Barbados. I thought I wanted to be a doctor, so maybe like some people here. And I was all prepared to go to med school. I was volunteering on the hospital ward at the main hospital in Barbados, and I ended up on the pulmonary unit with an incredible pulmonologist who was literally just spending all of his days caring for AIDS patients who were dying of pneumocystis pneumonia. And this was early 2000s, so drugs were already available. We already had triple therapy, and we couldn't afford it in Barbados. The drugs were too expensive. It was like $20,000 US a year for patients to get drugs, and our government couldn't pay for it. And that was a moment that like started my journey away actually from like a desire to practice medicine to like asking all these questions about why that was so. And I didn't know it at the time. I had no idea what like healthcare advocacy or movement building or like grassroots power building like looked like. I didn't even know those terms in that way at that point. But it started me on a journey of like figuring out how to build power to change like a completely ludicrous like proposition that like profit should be put above human lives. And yeah, so those are the two stories that I wanted to share with y'all.
Thank you, Jamila. I appreciate you rooting this in your personal story. Devesh, why don't we go to you next?
Great. So yeah, my primary experience, witnessing the effects of profits, impacting healthcare, it was with my former employer. So for about 4 years after graduating family medicine residency, I practiced at an FQHC in the San Diego area called Family Health Centers. And, this is, I think, what happens for a lot of physicians in practice. I wouldn't say it was necessarily a horrible place to work. Maybe partly because physicians are sort of necessary as part of the billing infrastructure. They don't treat us usually that badly. Um, but I would sort of observe certain things that I felt were unsafe for patient care. Despite knowing that the large organization was sitting on a lot of money and liquid cash assets. And so, for example, I worked in a clinic that had a lot of refugees, a lot of immigrants, a lot of very sick patients, and we would frequently feel like we didn't have enough support. So I wanted the clinic to hire a registered nurse because RNs can actually triage patients, and so they provide a level of support for the clinic that is significantly higher than that of the people in other roles can provide. And what we would find is anytime we asked for something specific, like if it was for an RN to support triaging, or if we wanted more care navigators to care for our newly arrived refugee patients. We cared for a number of people who were coming recently from Afghanistan, also from Haiti. And we knew these patients would do better with more care coordination support. But the answer was always no from the higher ups. And so, after repeatedly trying the standard channels to improve patient care, that was sort of when I personally began delving into nonprofit filings. And, a lot of this information is available publicly. You can just do a quick Google search and find this information, and found that my FQHC system was sitting on, $300 million in liquid assets. And so that to me, it felt unjust. It felt inappropriate that we have patients who can barely afford their next meal, and yet their clinic has all this money. And not to say that every FQHC is like that. So, actually, the current one that I'm at right now, I think they do a much better job in caring for patients in the community, and it's very obvious in everything from how the clinic is designed to how the employees are taken care of to how patients are cared for as well. But yeah, so just witnessing that this organization that I was at previously had the ability to do so much and yet was choosing to do so little, that was sort of where my activism began.
Thank you so much, Devesh. Another powerful story. And Ralph, why don't you share your story from the trainee and student perspective of when you've seen profit be prioritized over your own medical training?
Yeah, absolutely. So last fall, I enrolled in the University of Minnesota Medical School, and one of the things I heard about was from my seniors. So I think Carson's here, and also yourself, Miranda, told me that there was this course being run for fourth years, an elective run in collaboration with the university and United Health Group, which is based in Edina. So it's conveniently able to collaborate with the university. And the instructors of this course were actually circulating the syllabus, trying to invite students to apply for the next iteration of the course, and also showing off a new publication that they had put forth in the New England Journal of Medicine Catalyst. And they were really describing the course as a success. And I think advertising it also as like a proof of concept for other universities to try to partner with industry in education. So one of the surprising things that came out of this paper that they published was that there was a financial tie. This wasn't something that was really known until they admitted it themselves that UHG was funding 20% salary support for this course. And so to me, and I think to a lot of students, this was just a blatant conflict of interest. Um, from the materials that they gave us alone, we didn't really have a full grasp of the course. But fortunately, Miranda, you were able to put the SNAP membership in touch with Dr. Allison Leopold. So she's now a resident in California, but she is a University of Minnesota graduate. And so she took the course in its inaugural year. And she was working on an op-ed that's now published in the Minnesota Reformer. But she described her experience actually taking this class. And what she said really went in contradiction with the story being painted on the administrative side. So she described that there was not really balance. It wasn't a neutral academic presentation of like health financing. Rather, it was oftentimes an onslaught of corporate propaganda. And if there was any balance, it was from students who were really skeptical because a lot of people have strong opinions about United Health Group and United Healthcare, and they're skeptical when they're given a presentation on value-based care from a bunch of corporate representatives. And the other concern was that this course was being run and rerun while University of Minnesota Physicians and Fairview were negotiating a new deal. And in one of the iterations of the class, the CEO had actually come to a presentation and talked about wanting to expand the relationship between the group and the university. And so there was a lot of concern that the university might have been using this instance of a course and a financial relationship as a stepping stone to some sort of greater relationship, maybe even something like what you see in Kaiser Permanente School of Medicine. So it was already a big conflict of interest, and there was a lot of concern about how this might grow. And yeah, that was really concerning. And so we really organized to sort of tackle this issue.
Yeah, thanks for that great summary, Ralph. So when all of you guys recognized, whether it be early in your life like Jamila, or as a student like Ralph, or now working professionally like Devish, when you guys realized the ways that these healthcare systems were prioritizing profit over patient well-being, over employee well-being, or over student well-being, what actions did you guys take? And I'm really wondering if you guys could talk about like what that organizing process looked like for our attendees tonight. And I'm especially interested in how you identified your allies in this process and how you collaborated. So Jamila, why don't we start with you again?
Let me get off mute. Well, I'll start with like sort of the work on HIV treatment access around the world, which I spent the first half of my working life working on, and as a student started working on, even before I myself had my own healthcare story. When I saw what was happening in Barbados and I began to read about treatment access elsewhere, I felt really angry. Like I felt really, really angry and really disillusioned. And I had a moment, and I think that this is often like true in people's organizing journeys or stories. And I want to say it in case anyone's feeling that way right now. And I felt really, really like sort of lost and very unsure about what I could do about it, right? Like felt really, really powerless. And I ended up through a lot of like serendipity, a lot of like good fortune at a small, tiny liberal arts school in Vermont because there was a professor there who was working on HIV treatment access around the world. What I didn't know is that she really was an activist and an organizer. She had like spent a bunch of her time like working really closely with folks at ACT UP New York and spin-off groups that came out of that, like the Health Global Access Project. And I remember I fought to get into her like class as a freshman, my first semester there, because I was like, this is why I'm here. This is a senior level class, but I got in eventually. And I remember sitting in her class the first the very first class, she was talking about power and beginning to frame what was happening in terms of treatment access in the rest of the world, but like grounded in a framework of understanding power, understanding greed, understanding corporate power, and I remember just sitting there with tears coming down my face. And she like organized me in many ways. And at the time, there was a group called the Student Global AIDS Campaign, which maybe some folks on this call would know about. That was a group of students across the US that cared about what was happening elsewhere around the world and felt like US drug companies and the US government had a responsibility to ensure affordable treatment access around the world and not stand in the way of that. And so I ended up starting to work with this group of students. And we, as students, we did the things that like now I see like that's just organizing. It's what people do. We spoke to other students both on our campus and on other campuses about what our responsibilities were and what could do. We sat with other activists who weren't students, just other people in the AIDS movement who like welcomed us as young people who didn't know anything into a room, treated us as like partners in scheming and thinking about power. We power mapped and like figured out what campaigns we should run to win various things. We had a campaign. I remember one of our first things was like pushing all of the Democratic and Republican candidates at the time in the 2004 election to have a position on HIV, like, and to have a platform on sort of global HIV treatment access, and successfully got all 9 Democratic candidates at the time to do that. I had my first experience going outside the RNC national like headquarters in Manchester, New Hampshire, and getting the door slammed in my face and feeling even more fired up and like energized after that, after being told no and after being dismissed. Like, going into events, town halls that were happening around the country as students and asking questions of the candidates about what they were going to do about the AIDS crisis that was killing many, many people around the world. And like, seeing a result, seeing Democratic candidates begin to feel the pressure and capitulate, seeing Bush like create PEPFAR and spend huge amounts of like US government resources on completely transforming the landscape in terms of universal treatment access around the world, some of which we're seeing undone right now by this current president. But like, I witnessed the power of grassroots people, regular people like me, students and like poor people from elsewhere around the world and people living with HIV and queer folks. And, here in the United States, like fighting together, scheming together, figuring out how we could get leverage, using direct action, organizing, talking to people, getting more people to care about what was happening like far across the world, right? Like, and then winning stuff. So like for me, like that was the thing that felt like, I think I know that organizing works because I have witnessed it in my lifetime. I've been part of fights that have won and won pretty remarkable things, like shifted the cost of treatment, HIV treatment, to less than, $100 a year from $20,000 a year for patients. Provided treatment to millions of people around the world that wouldn't have had it, challenged pharma's like logic around the pricing of medicines when it came to HIV drugs, and really set a precedent for many other fights around drug pricing that we've seen since. And that's just one of the fights that I can speak about having won, but like organizing for me, like I believe regular people, I believe poor people, I believe sick people can have power, and I believe it because I've seen it. And I feel really grateful to the people who organized me, who helped me see that, who were with me on the picket lines, on the protest lines, in the bird dogging like sessions, and who accompanied me, who debriefed with me when we lost, who celebrated with me when we won, and feel so convinced that that's the only thing that's going to change the reality of corporate greed in our healthcare system is that kind of organizing.
Amazing. So amazing to hear, Jamila. Thank you so much. Devesh, why don't we hand it to you? What did, for example, employee organizing look like in your story?
Yeah, so I'm going to take a little bit more time on this section because I think there's a good amount of detail to share, and I understand we have a number of learners here as well. So I want to make sure that people learn from my experience. So I would say, my own personal journey, I kind of had summarized that we noticed that there were some issues with concentration of power at my last FQHC, and that they were sitting on a lot of cash that they weren't spending on the community. I had at the time just personally already been involved in a number of different political activities, and I think that was part of what I think helped me be poised to do this work. So I had recently run for school board in my community. I was an elected delegate to the state Democratic Party. I was making inroads with local labor, and so I think all of that played a role in sort of the attempted unionization effort that continues to this day. But essentially, what happened is when we noticed that there were these problems, there was a group of us that tried to kind of get together and talk about what we could do as a unit. There's a common misconception that attending physicians cannot unionize, so that's not true. The people who can't unionize are supervisors, so that's people who hire, fire, and discipline employees. That's considered like the standard definition. And so if you have a physician who's not doing those things directly, then they have absolutely the legal right to form a union. So I think part of our initial work was just understanding what's allowed. I did want to just give a quick shout out to Krister because I saw that you commented, and he has actually himself successfully unionized a group of physicians at an FQHC, and maybe actually be a more accomplished person to talk about this than me, but happy to keep going here. And so we initially founded basically a core group, and that group was tasked with discussing ways that we could speak as one voice about the issues we noticed at our health center. At the same time, asking around with contacts, we learned that there are essentially two unions right now that are working extensively with attendings. One of them is called UAPD, and the other is an affiliate of SEIU called the Doctors Council. And so we found that these were kind of our two options. We then started just having more and more meetings. And it was funny because this happened maybe about 18 months ago. And as this process was starting, it was clear that the admin side was also gradually escalating. And so we would start getting emails from managers saying things like, okay, we need you to see more and more patients in less and less time. You could tell that just the amount of bandwidth that was being given was sort of slowly being like tightened and tightened on us. We would hear comments, and I was also part of sort of a local leadership group in the clinic, and we would hear comments like, if you don't see enough patients, the health plans will fine us, talking about the managed Medi-Cal plans. And there was no real evidence to support that. So we were essentially hearing flat out lies. And so I think when you hear things that you know aren't true, that's sort of further infuriating, right? So it's like I am seeing version A of the truth, and someone else is telling me that what I'm seeing is actually version B. So we were doing really well. I would say in early 2025, we had about 40 different physicians and APPs across our whole system that were ready to commit to a union vote, and we'd also picked a union. And then around that time, it was a Tuesday afternoon. I was basically called up by my clinic director. And I have two young kids. I had health insurance through my work. My wife, was also on the health insurance. But I get called up upstairs, and then lo and behold, the chief medical officer, the president of the entire FQHC, and then a representative from HR were all sitting there in a room, and then they proceeded to terminate me. And I was actually told directly that my reason for my termination was engaging in union activity, despite having been told to not do so. And the interesting thing is they actually were able to find two other reasons for terminating me that they had never told me before. So the first day I heard them was on the day of my termination. So that was definitely a low point, extremely challenging, obviously, with just find family things, and was not my goal, obviously, to get fired. But I think in some sense that was maybe the straw that broke the camel's back. So I proceeded to sort of become pretty public with what had happened to me. The remainder of our core group continued to organize. And so, I had a LinkedIn post that went kind of viral. We tried to get a couple news outlets, like to Ruff's point, to publish, but I think we have some editors in the area that are kind of anti-union. So that process is still ongoing. But yeah, the union is now sort of reconnecting and is planning a vote possibly later this month. So I don't think the fight is necessarily over. It continues. But I did, personally face that retaliation. And I think the things that helped me get through that period after I was terminated, having connections to labor because I felt like all hope wasn't lost. So I had a lot of phone calls with local labor union leaders. And then also professionally, because I've been very engaged in my professional society, the California Academy of Family Physicians, a lot of those folks, like leaders in the medical community, were my first calls. And so that was what enabled me to eventually get back on my feet, get a job again, and then still remain kind of in the fight to some extent. And I see Krister's comment, your resolve is impressive. Yeah, it was a really shitty few months over summer. I'll be honest, not a fun time. But you get through it. And I think what I realized in retrospect is like I was coming to this from a perspective of relative privilege. A lot of family health of FQHC doctors are sort of bound contractually by having significant debt from med school and undergrad. And part of the contract is if you work in an underserved area, you get your debt forgiven after a certain set number of years. And I didn't necessarily have as much debt as some of my other colleagues. And so I could sort of weather that storm and then, go on to another job. But what I realized after it was all said and done is that I think I did something that I ultimately had the bandwidth for. And so I was able to get back on my feet and keep fighting. And I think that's one of the big lessons for everyone who's on the meeting is, think a bit about what you are capable of. And then if it's within your power and you care about something, then do it. I mean, I have no regrets about having engaged in that organizing work, and I'm going to keep doing it moving forward as well.
Wow, what an incredible story, Devesh. Thank you so much for sharing that and yeah, inspiring us with it. Ralph, will hand it to you. What are the ways that you saw students take on this issue with United Health Group?
Yeah, thank you, Miranda. So in terms of the organizing process itself, that was, in simple terms, pretty straightforward. At its core, it was organizing and getting a petition. We basically wrote a letter to the administration describing how it was just a blatant conflict of interest to work with an insurance company to direct a course. It's not academic to do so because you cannot ask a group like that to present on health financing in a neutral capacity. We timed the release of this letter and petition to line up with the aforementioned op-ed just to help with generating a little bit of buzz. But really the biggest effort was pestering all of our peers on campus. So me, Sanjeev, Kaden, Carson, Abdullah, the rest of the SNAP members who were on campus, so first and second years at the university, we just went to everybody we knew, everybody we saw, interrupted their conversations, told them there was something really important we had to tell them about. Some of them probably thought we were trying to sell them something at first, but once they heard what we had to say, it was really pleasant to see that people gave us time and patience and listened and realized that this was something that really affected them. And another part of your question was who were allies. And at first it was just our team, right? It's a student org. We have our membership, but it really became the entire student body because people very quickly were able to understand what was at stake, whether it's for themselves. Some people had concerns with, is this going to affect my residency? If the university I come from is associated with an organization that is basically hated nationwide, or they had concerns, just in principle about, having conflict of interest. And so it really became the entire student body. We got over 75% of first years to sign our petition. We got the majority of second years. And those are the two classes that are actually on campus while upperclassmen are on rotations. So that was really encouraging. And so the result of that was we sent our letter out to the administration. They got hold of it really quickly because they knew it had a lot of traction. And at first they tried to sort of appease us with a listening session to maybe quell some of our concerns. But we had over 100 students show up to that listening session to voice more objections and more concerns. And that was in the middle of a snowstorm. Um, and it was really encouraging because, I came and our team came with like prepared talking points and things we wanted to have be heard. But 100 other students came on their own volition, not part of any student or organizing process, but just because they found out about this and they knew that something was at stake. And I think the turnout at that listening session really was the last straw. And so the administration really realized it was untenable to maintain that relationship. And then in January, they basically conceded to every single one of our demands. So they terminated the course, they replaced it with a neutral one with no financial ties. And that was really satisfying to see.
Awesome. Thanks, Ralph. The other thing I'll say is that some of our colleagues had even testified at the Minnesota legislature just the other day to make sure that this doesn't happen in the future with our curriculum and a massive corporation. So it's an inspiring story. Yeah, I'm so inspired because just wow, all the things that we can do, from just being like a normal person to being somebody in medicine to being a student when sometimes you don't feel like you have a lot of power and then realizing you do have a lot of power, right? So you've all really shared how resistance to corporate capture is happening in all these forms, from patient organizing to student advocacy to workplace organizing. So I'm wondering, what gives you all hope right now in this fight? And what are concrete ways that all of us can get involved in pushing for this kind of change? Jamila, I'll go back to you.
Yeah, I mean, one thing to say is like for, about 12 years of my life, I spent doing, international work on HIV treatment access, which was very much grounded in the stories I shared about corporate greed in healthcare globally. Um, and that story, but the first story I shared, which was my own personal story, and the experience with the contrast between me and Nadine that I still live with and still haunts me was sort of there for me. And Leighton and I hadn't really organized from that place. Um, and my current work is very different because my current work is animated by that. Reality is animated by um, the many challenges that I've had navigating our really broken for-profit system, and and feels very different, like feels riskier, feels like sharper and clearer than ever before. Um, but like in the way of like what is giving me hope, I want to tell you guys a little bit about what I've been up to recently and what we're trying to build. Um, for more than a decade now, I've had a dream, like literally a dream. And anyone who knows me knows I'm not like a super woohoo person, so I'm not like, not something I say lightly. But and I've had this dream often recurring for me in different like glimpses of things in moments where I felt like the least powerful in my life. Moments where I've had a cancer scare, my insurance is denying the care that I need or the diagnostic tools that I need to even like figure that out. Um, Moments where I've spent hours on the phone with my insurance company or arguing about claim denial, moments where I've been really scared about the cost of healthcare that I'm navigating. And in those moments, the dream for me has been like, what if patients had a union? What if patients had a fight force for us, by us, that could actually fight to transform this system? And it's like that very little like glimpses of a dream, that very simple but actually in real life complicated proposition of and question of what if patients had a union, like what could actually change our healthcare system, has been animating my current work. And in the next couple of weeks, we are already moving in many ways in trying to build the Patients Union. Well, if you go to patients.org, we have a holding page up. We'll have a website in the next 2 weeks. And we're starting to try to figure out how to organize patients in this country, because what I do know about the system now is that the experiences that I've had with profit being put over my own care, it's not a glitch, right? Like, it's actually designed this way. Like, this system is designed for profit in a way that harms providers, nurses, and doctors, and healthcare workers, of all kinds, right? Like, and in a way that most importantly doesn't serve and just like harms patients. So it's not a glitch. And the truth is, like, and the thing that I think like makes me angry is like the people who are designing the system, who are benefiting off it, they're really ultra organized. They're super coordinated. They're incredibly powerful as a result. They spend millions of dollars lobbying our government every year. The insurance corporations, they're organized. The hospital systems, they're organized. The pharmaceutical like corporations, they're organized too. And they negotiate and they set the terms and they shape the rules, and we're all supposed to live with it. And I think like my frame is like the only thing that can change this reality, the only force with enough power to change it just by sheer numbers, right? And share ways that we contribute to the system is like patients and workers together, actually, like, right? Like taking on the system. And what we've seen is that patients are often not organized in this way. So we are trying to build a patients union because we think the truth is that patients don't lack courage, and we don't lack resilience, and we don't lack stories that are like powerful enough to change the world. But what we do lack is organizing. What we do lack is power. And our isolation, us fighting alone, like keeps us in a place where we don't have power. And when patients are organized, what I've seen in my AIDS organizing and in other parts of my work is that we're no longer invisible. Even when we're marginalized and we're like the least of people who people care about, through our organizing, we can become visible. We're no longer isolated. We're no longer easy to ignore. Like, we can actually become a force that can demand transparency, a force that can demand accountability, a force that can actually say and make real that people's lives should never be a profit strategy. And so we are trying to build this right now. And I'd love to talk to anyone on this call who's like, what is the patients union? I want to know more about that. Or I want to help build that, because I think that this gets built by hundreds of us, then thousands of us, and then millions of us standing together. Because there's absolutely nothing that's inevitable about the way that the system works right now. So I absolutely believe that we can change it. And that's not pie in the sky. I've seen it. I've seen it in organizing and activism over the course of my life. I feel lucky to have borne witness to it. And when you see it, you can't unsee it. And so you just have to keep organizing from that place and fighting from that place.
Oh, I have chills, and I can't wait to join the patient union. So thank you so much for sharing that. Devesh, I will hand it off to you.
Great. So I think to answer this question about what gives me hope right now, I think it's actually a good segue from Jamila's comments, which is that I think interacting with my patients, to be honest, is what gives me the most hope. In this current job, I'm seeing a lot of younger people because that's who lives in the neighborhood of this clinic, and a lot of people that are really trying to take their health into their own hands despite the challenges of the system. And I'm seeing a lot of agency and a lot of that kind of self-confidence. And so I think seeing people sort of drive that, to me, gives me hope. The question for how to get involved in pushing this type of change. So one thing I think is to, and I had mentioned this earlier, but trust yourself and your own judgment. You're all highly educated people. I understand a number are pursuing, definitely bachelor's, higher degrees as well. And if you feel like something seems off or seems like BS, there's a good chance you're right about that. So sit with that thought. Journal about it, talk to your friends about it. I think that so much of what happens in the healthcare system, whether it's what the pharma companies are doing or what RFK Jr. is doing, it's a lot of like smoke and mirrors, and then we'll just get this random thing through. And so trust that, trust your sort of sense of what is right and wrong, and believe in that and kind of sit with it, because it will eventually result in something. I think the other thing that I the second, probably most important lesson I want to share with all of you is, and maybe this is just something that comes with time as you get older, is start seeing your peers not so much as competitors, but as people who inspire you. I think this is one thing that can happen in these journeys, especially with social media and Instagram and this and that. You open your phone, you're like, oh my God, like this person is doing blah blah blah. I mean, I'm essentially the same age as the current mayor of New York, so there can be this thought of like, wow, why can't I do that, right? But what you realize over time is that like we're all fighting this battle sort of together, and there's no telling also when your time will come. I mean, that's the other thing. Like, okay, right now so and so is doing something great in my med school or in my residency or in my public health school, whatever it is. But let me sit, watch this person, see what they're doing, learn from them, right? Tell them that they inspire me. And then when my turn comes and I'm ready and I have the bandwidth to do something great, then let me consider it, let me step up. And I think that sort of attitude is what actually is both internally more meaningful and also societally more effective.
Thank you so much, Devesh. Yeah, it's all about solidarity building. Ralph, why don't you end this last question about what's giving you hope and how can learners get involved in pushing for this kind of change?
Yeah, absolutely. It's a great question, actually, because I think it really depends how you look at it. So, at the institutional level, our group is coming off success, right? Like we got what we wanted. And that in itself is a reason for hope and optimism. But to be fair, if you look at the state level, if you look nationwide, there's, I don't know, like a sense of calamity. Like it feels like things are falling apart. Um, so I think, you know, on one hand, it's important to see what your scope is, and also kind of like Dr. Devesh said, think about timing because it really, I think, comes down to being opportunistic. There's not always opportunity to get traction on certain issues, but when the time comes, you have to jump on that. And in terms of scope, I mean, you know, in our case, the med school is not that big. So when you think about lobbying and pushing for change, if you're looking at cities and states, it's thousands and millions of people, and you'll never be able to talk to all those people and change their minds. But in these smaller scopes of your institution, your workplace, whatever it is, you have influence, and the numbers game is not so ridiculous. And so the scope becomes very feasible. Um, and then the other thing I was talking about, sort of how on a large scale things might look poor. Paradoxically, I actually think that um, is really a cause for hope. Crises are a lot of the times the things that force change, force radical responses. Here in Minnesota, the federal government is withholding $259 million of Medicaid, and it's going to have really drastic effects on Medicaid here. But it's not a coincidence that now our governor, Tim Walz, is endorsing a bill to deprivatize Medicaid, a bill that we've been pushing for in single payer communities, because that cut to funding means that you need to make that money back somehow. And so getting rid of these middlemen and moving Medicaid to a deprivatized system is a response that a lot of these people would not have cared about before, and they would have not wanted to join this movement, but their hand has been forced by a crisis. So sometimes when things are getting worse, I think it forces a response, and that can actually be a cause for something really productive. And so even if it's paradoxical, I'm hopeful that sometimes when things are getting worse, it means that there's an opening and a chance. And if you jump on that, something good can come out of it.
Awesome. Thanks, Ralph. Well, I am just so inspired by all of your stories and the work you're doing and the way y'all organize, and you've empowered me tonight in so many ways. So I'd love to open it up to the audience and see if there's any questions for our panelists. Feel free to raise your hand, put it in the chat, or come off mute. Hi, Dr. John Crossan. Why don't you go ahead with your question?
Hi, Miranda. Well, of course, was inspired by this conversation. It was excellent. And I'm also in Minnesota, and I have been working on trying to get universal single payer healthcare in Minnesota and in the United States for close to 30 years. And one of the problems that I'm seeing right now is not with the young people. But I have an age when I have contacts with retired physicians. And my contacts with them, some of them who've worked on this movement before, they've lost hope. They say, why do we keep doing this? It's never going to happen. I'm getting old and I want to enjoy my last few years. I don't want to be involved in advocacy. What would you folks say about to those physicians?
I don't know if it's Miranda, if you want us to jump in here. I mean, um, those physicians are not alone, right? Like every day as organizers, we're talking to people who are actually like pretty, like have been screwed over at every turn, um, and who are struggling to see a cause for hope um, in this moment. And I feel like my instinct isn't to first wave that away. Actually, it's not to like say, well, you shouldn't feel that way. Like, actually, there's a lot of reason why people are feeling a crisis of hope right now, actually. And
But these physicians are retired. They're doing okay. Their health is in pretty good shape, and they do have some reasonable insurance, and so they're not at all worried about their health care, and they don't want to be involved in this movement.
Mhm, mhm. I mean, I feel like for me, my conversation's always to try, like my approach is always to try to engage people from where they're at. So maybe I can give two examples of conversations like this I've had. I had a conversation recently with an ally in the movement. It was somebody who was from a different corner of the movement and who was sort of like, I don't really know, like, would people really identify as patients? Does it really make sense to organize patients? So wasn't bought in the in the approach or in the analysis. And by the end of the conversation, or like halfway through the conversation, it became really clear to me that this person was a patient too, and that she had experienced, because I actually think that everybody in this healthcare system is experiencing failures. It's just that we've normalized them so much. And so very quickly, I engaged her in conversation about, um, she mentioned being in an accident when she was young and not having insurance. And I was like, and telling them not to call the ambulance because she didn't have insurance. And I said, wait, hold a second. Like, and I actually had to catch my breath because that made me tear up because my heart is tender to those because I think they're unjust, right? Like I'm like retraining my brain to not normalize like what feels really normal as injustice. So even folks who are relatively well off, or actually who are very well off in this country, right? Like, so doctors with decent health insurance, like I guarantee you they and their loved ones are experiencing like failures at the hand of this healthcare system. And I feel like in every conversation, in almost every conversation that I've been able to be in, even with the most resistant people, I've been able to, by the end of the conversation, even if they don't want to come along and like fight our fight, establish that they also have some self-interest in what we're trying to build, that they also um, I have neighbors who have a Confederate flag that faces our property right now and who we don't agree on a lot. But a couple months ago, engaged in a conversation about healthcare with them because they were facing a healthcare crisis that we were able to help navigate. One of the reasons why I organize around healthcare And why I feel like it's so important now in this moment, and I'm not spending my time doing other things that I care about, is because I do think healthcare is provides an opportunity to bring people together across a lot of differences and divides that otherwise would be really hard to do. I do believe that most people in this country experience failures at the hand of this healthcare system. If you've practiced medicine in this system, you've experienced failures. You've just normalized them, but you've experienced failures that no doctor should have to navigate in trying to provide care for their patients. And so part of our work as organizers is like taking people on a journey to help them see that, right? And then grieving with them and then figuring out what we can do about it. So I don't know exactly how I would engage, but like, put me in touch. Let me let me talk to them.
That's actually very helpful. Thank you.
Did any of our other panelists want to respond to that question at all? Any other questions from the audience?
I have a comment that I hope can I'd love some responses from y'all. My name is Christopher Brady. I'm a family physician in North Carolina. Had been working at FQHC, and as Devesh said, we formed Piedmont Providers United and successfully unionized. And it was both a very successful effort and really draining from the resistance from our organization and the pushback, from a community health center, a network of community health centers. They hired the biggest anti-union law firm in the country, and they were organized, just like Jamila was talking about. They were incredibly organized and did a great job at breaking us down just by sort of a battle of attrition, more of anything. But I think one thing that really came out of that is I think the dangers of only organizing in your own sort of power group. We were a provider union, and ultimately we needed to be an all staff union because the folks that our community health centers purport to serve are really the community members that work in our clinics. And I think, and most of us providers aren't actually from the community. That's not true for everyone. I can't speak for everyone. But I think what they did well, our organization, in terms of pushing back, was their argument that had some traction was that, we were really just working on increasing our salaries, making things better for ourselves. And there was some traction to that because we really had to focus on our pay and all these things that we really deserve, and that but we also feel that our patients deserve, and every community member deserves. And so I think, just like Devesh, you were saying, it started for me as sort of this doesn't seem right that we're just providers here, and we need to be sort of more intersectional, basically. And so it's really this. I guess this is mainly a comment from Devesh, like that gut sense of wow, we need to be more intersectional, and the current systems do a really good job at isolating us. So anything that we can do that sort of de-isolates us is the best. I mean, honestly, just talking to other clinics was the best part of our organization, to understand that the issues I was having as a provider in my rural clinic were shared with other clinics in different settings. And so that's sort of my comment to everything I've heard so far. And I just really appreciate the panelists tonight.
Yeah, and I wanted to add just briefly on Krister's point, which is that even though Krister and I technically know each other, you know how life gets in the way and it's hard to even make time for like a phone call. So I read the news article about your effort successfully organizing a community health center while I was doing my organizing. And to your exact point, it made me feel like it was possible, and like I knew someone, like an actual friend who had done it. And we haven't actually talked since then until today. So it's such a pleasure to see you here. Thank you.
Awesome. I love that this space can be used for that. Exactly. Building these networks. I see that there are two more hands up. What I'm going to do is wrap up just for the folks that need to log off. But remember that right after this, we'll stop the recording and then there will be an unstructured discussion. So those folks can maybe hold up and ask those questions then. But I want to thank you all so much for being here tonight, to all the attendees, to our three panelists. We are just so honored for you all to share your wisdom with us and like we said, build solidarity here in this space. I'm going to let you know other ways you can stay involved with the Social Mission Alliance. We have our For Us All campaign. This is a campaign mainly student organized, especially through the Health Justice Fellowship, where we hold our institutions socially accountable. We'll be dropping a link in the chat so you guys can learn more about it. And follow us, Social Mission Alliance, on social media. We're very active on Instagram, LinkedIn, all those things, and it's a great way to keep up with everything we're doing.